people didn't want to say like, yeah, we're struggling, or even know that they're struggling, right? Some people are like, yeah, I've been having unprotected sex for 7 years, but we haven't actually been trying. But in the medical world, that would actually count as trying.
Would love to kind of have you share kind of on a macro level um, what you're seeing with infertility statistics right now, how many couples are dealing with infertility, and then also, how many women you're seeing with kind of hormone imbalances.
A lot of people ask me this question, and they also ask me my thoughts on like why the rates seem to be declining so rapidly. And I think, one of the key answers is it's being talked about more. And so I think we're actually knowing who's actually struggling trying to conceive versus it being as like a taboo topic that no one talks about. So one, I do think that that's a piece to it. I think it had been declining. It's just maybe showing a more rapid because we hadn't had the numbers hold necessarily properly before, because people didn't want to say like, yeah, we're struggling, or even know that they're struggling, right? Some people are like, yeah, I've been having unprotected sex for 7 years, but we haven't actually been trying. But in the medical world, that would actually count as trying. Maybe not, you're not planning based off ovulation every single time, but if you're not keeping track or providing any sort of protection, that technically is trying, right? So one, I think it's a little bit about that. Two, I do think it has to do with the environment that we're in, right? I think it's our food, our water, our stress, our, mental load that we're carrying, and emotional load. I feel like, not necessarily that it's increased, but I think with everything in today's world, we have more time to sit and think about things, which can be good and bad in multiple ways, which again, is also kind of a longer conversation. I feel like I keep repeating myself, but when I say that, I'm just wanting to make sure that, you're not just taking what I'm saying and just like rolling with it, that there's also more exploration in what I'm saying, because I think
Yeah.
that's all very important.
Yeah, absolutely. I mean, so getting more granular, what lifestyle changes do you recommend first and foremost for your patients who are dealing with gut health related fertility issues?
So first off, a lot of people don't understand that like the basic diet and lifestyle stuff, yeah, it's good for reducing your stress, and yeah, it's good for your hormones. It's also really good for your gut. Like good sleep is very essential for good gut health. So it's just following that movement, right? Does anyone ever talk about like, so if you're a little constipated, if you start exercising or you go for a walk, all of a sudden you're going to poop? Like that is actually really beneficial. Movement is very helpful for gut. Obviously diet is going to be big, right? People talk about, I know, like probiotics and prebiotics, and those are really good. I love to emphasize fiber, 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 fiber. People talk about even 20 grams. I used to say that. Now I'm more on the side of like 30 to 40 grams. The more I love fiber now, I'm all about the fiber, especially for gut health. The biggest key there, though, is if you're only having like 10 grams of fiber a day, slowly increase the amount that you're having a day, because that could get really uncomfortable really quickly. And then water intake, obviously going to be important. Working on stress and reducing stress is going to be important, right? I mean, people talk about your parasympathetic nerve and how that is very important. Rest and digest, right? Your vagus nerve. We want to activate that. And if that's not activated and we're in constant fight or flight, we're not going to rest and digest properly, right? And that's going to be essential. So, I mean, those are just a few things, but very impactful.
So, what are some of the red flags that would kind of separate someone from needing more intense treatment versus just needing lifestyle changes?
Well, I'll be the first to say, like, with my fertility patients, I'm pretty much always giving them additional recommendations besides lifestyle changes, just because my population, they've usually waited already a long time. They've done a lot of effort. They've been doing the diet and lifestyle things consistently for 6 months to a year. Like, I have a very unique population. So I'm always doing added things. I personally think if you want to heal a little bit faster, it's nice to have those added things, right? It's just some gentle herbs and supplements. I always think we should be treating candida, especially with herbs and supplements. I think there are some docs out there that will be like, just, stop eating sugar. There's been so much research done that have actually shown that candida actually can figure out how to survive without sugar. So you're technically not going to starve it. You might make it a little bit weaker, but the moment you add certain things back into your diet, it's going to flourish again. So getting rid of candida, I think, is going to be one of those things where we need, herbs, antimicrobials, immunoglobulins, prebiotics, probiotics, but basically we want things that nourish the gut lining, right?
Yep.
DGL powder, curcumin, glutamine. Again, these are things to not just start doing right now. These are things to talk to a practitioner about and very, very much figure out what you need based off your results. But I'm always going to be someone who says, get a gut test and let's treat with herbs and supplements.